The miscarriage, also known as a spontaneous abortion, is the loss of a pregnancy before the 28th week of gestation. It is a common pregnancy complication, with approximately 10 to 20% of confirmed pregnancies ending in miscarriage, though the actual rate may be higher as many losses occur before a woman realizes she is pregnant. Types of miscarriage: threatened miscarriage. This occurs when there is vaginal bleeding and cramping, but the cervix remains closed. The pregnancy may still continue. Inevitable miscarriage. Vaginal bleeding and cramping occurred, and the cervix opens, indicating that miscarriage is unavoidable. Complete miscarriage. All pregnancy tissue is expelled from the uterus, and bleeding typically subsides afterward. Incomplete miscarriage. Some pregnancy tissue remains in the uterus, requiring further medical intervention. Missed miscarriage. The fetus has died, but there are no immediate symptoms, such as bleeding or cramping. It is often discovered during a routine ultrasound. Recurrent miscarriage, defined as having 3 or more consecutive miscarriages, although many women who experience recurrent miscarriage can go on to have healthy pregnancies. Causes of miscarriage. Miscarriages can be caused by various factors, though in many cases the exact cause is unknown. Some common causes include chromosomal abnormalities, the most common cause, accounting for about 50% of miscarriages. These abnormalities occur randomly as the embryo divides, leading to problems in development. Maternal health conditions, uncontrolled diabetes or thyroid disorders, hormonal imbalances e.g., progesterone deficiency, autoimmune diseases e.g., lupus, antiphospholipid syndrome, uterine abnormalities e.g., fibroids, uterine septum infections, certain infections, such as cytomegalovirus, CMV, rubella, or sexually transmitted infections. STIs can increase the risk of miscarriage. Lifestyle factors, smoking, excessive alcohol consumption, and illicit drug use can contribute to miscarriage. Obesity and excessive caffeine intake more than 200 mg/day may also increase risk. Trauma or injury, severe physical trauma, especially to the abdomen, can increase the risk of miscarriage, though it is relatively rare. Age, the risk of miscarriage increases with maternal age. Women over 35 have a higher risk, which further increases after age 40. Symptoms of miscarriage. Signs and symptoms of miscarriage may include vaginal bleeding, ranging from light spotting to heavy bleeding with clots, cramping, often stronger than normal, menstrual cramps, abdominal pain or lower back pain, discharge of tissue or fluid from the vagina, sudden loss of pregnancy symptoms. In some cases, symptoms like nausea and breast tenderness may suddenly decrease. It's important to note that vaginal bleeding and cramping can also occur in normal pregnancies, so these symptoms do not always indicate a miscarriage. Diagnosis. If a miscarriage is suspected, the doctor may perform several tests to confirm. Pelvic exam, to check if the cervix is opening or if there is tissue in the cervix. Ultrasound, to check for the presence of a heartbeat or other signs of life. Blood tests. These may measure human chorionic gonadotropin (HCG) levels, which usually decline during miscarriage, or to detect conditions like infections or hormonal imbalances. Tissue tests. In some cases, tissue passed from the vagina may be examined to determine the cause of the miscarriage. Treatment. Treatment for miscarriage depends on the type and stage of the miscarriage. Expectant management. If the miscarriage is incomplete or missed, doctors may recommend waiting for the body to pass the tissue naturally. Medication. Drugs such as misoprostol can be used to help the uterus expel pregnancy tissue more quickly. Surgical management. Dilation and curettage. D&C, a procedure where the cervix is dilated, and the uterus is gently scraped to remove tissue. This is often used if the miscarriage doesn't resolve naturally or if there are concerns about infection. Physical and emotional recovery. Physical recovery. After a miscarriage, most women experience bleeding for 1 to 2 weeks. The next menstrual period typically returns within 4 to 6 weeks. Emotional recovery. Miscarriage can be emotionally devastating. and feelings of grief, guilt, or anger are common. It's important for women and their partners to seek support, whether from family, friends, or counseling services. Prevention. While not all miscarriages can be prevented, some strategies may help reduce the risk. Prenatal care. Regular check-ups ensure any health conditions are managed properly. Healthy lifestyle. Avoiding smoking, alcohol, and excessive caffeine, maintaining a healthy weight, and managing stress can help reduce the risk. Control of chronic conditions. Women with diabetes, thyroid disorders, or other medical conditions should ensure their conditions are well managed before and during pregnancy. Taking folic acid. Supplementing with folic acid 400 to 800 micrograms daily before and during pregnancy can reduce the risk of birth defects and possibly miscarriage. When to seek medical help. Immediate medical attention is needed if there is heavy bleeding soaking more than 1 pad per hour for several hours. You experience severe abdominal or shoulder pain. You have fever or chills, which could indicate an infection. Future pregnancy. After miscarriage. Most women who have had a miscarriage go on to have successful pregnancies. Doctors generally recommend waiting for at least 1 to 3 menstrual cycles before trying to conceive again to allow the body to heal. In cases of recurrent miscarriage, further testing may be needed to identify underlying causes, and treatments like progesterone supplementation or surgery may be considered. Would you like more information on treatment options or how to cope emotionally after miscarriage?